Benign prostatic hyperplasia, or BPH, is a condition characterized by the enlargement of the stroma and the glands of the prostate. Hyperplasia means increase in number of cells. It's not a hypertrophy, which would mean an increase in the size of the cells. Hyperplasia of epithelial and fibromuscular stromal cells leads to the formation of soft yellow-pink nodules. It is driven by 5-alpha-reductase activity in the prostate, which increases with age, leading to increased dihydrotestosterone production. Dihydrotestosterone then makes prostate cells live longer and multiply faster. This is actually a normal process of aging, and around 50% of men develop BPH by the age of 60. BPH is not associated with any increased risk for developing prostate cancer. Rather, as the prostate gland enlarges, small hyperplastic nodules can form within it. Hyperplastic nodules will typically form in the periurethral region of the prostate. Clinical signs include dribbling, this is weak and inconsistent stream of urine, bladder outflow obstruction, hesitancy, that means difficulty starting and stopping urination, dysuria or pain during urination, nocturia or increased frequency of urination at night, and incomplete emptying of bladder. Diagnosis of BPH starts with digital rectal examination, where the prostate will be symmetrically enlarged, smooth, firm, non-tender, with rubbery or elastic texture. Levels of prostate-specific antigen or PSA will be also elevated, since there are more cells around making the PSA. And finally, the intravenous pielogram or EVP radiograph will show an elevation of the base of the bladder by a smooth half-moon filling defect. This causes a deformity in the pathway of the urethra such that urethras end in a hook, also called fish-hooking phenomena. Treatment of BPH focuses on relieving the obstruction and allowing the urine to flow normally. This can be done through medication like finasteride, a 5-alpha-reductase inhibitor. The 5-alpha-reductase inhibitor shrinks the prostate gland by inhibiting the conversion of testosterone into dihydrotestosterone. But it can take up to 6 or 12 months for symptoms improvement, and side effects include decreased libido and erectile dysfunction. Next, α-adrenergic antagonists like terazosin, tamsulosin or prazosin can bind to alpha-1 receptors on the smooth muscles in the neck of the bladder, the prostate and urethra, causing them to relax and allowing urine to pass. Those are usually preferred for symptoms improvement within days to weeks. Side effects include orthostatic hypotension and dizziness. And the last, phosphodiesterase type 5 or PDE5 inhibitors like tadalafil can be also used, especially in individuals with concurrent erectile dysfunction. In some cases, surgical procedures like ablation or transurethral resection of the prostate or TURP can be done to remove part or all of the prostate. And also, it is important to change your lifestyle. This includes avoid liquids a few hours before bedtime or before going out. Limit caffeine and alcohol, as those may stimulate the urge to urinate. Eat a low-fat diet, eat a large variety of vegetables each day, eat a few servings of fruit daily, and be sure to include citrus fruits. Participate in moderate to vigorous physical activity most days of the week, and maintain a healthy weight. Studies have shown that if those measures are followed, symptoms of BPH can be reduced. And finally, what about complications? First, it's UTI, or urinary tract infections. It is developed because the stagnation of urine in the bladder promotes bacterial growth. Also, the urine can build up back into the urethra and the kidney, causing hydronephrosis or dilation of the renal pelvis and calyxes. Severe long-standing hydronephrosis can subsequently compress the renal parenchyma, resulting in atrophy of the renal medulla and cortex.